11:43, welcome back. Now on 12 News Midday, it is Medical Monday, and today we are exploring the full range of neck, spine, and back treatments at Bon Secours and how new AI-driven tools are helping tailor plans to each patient and bring those personalized approaches to life in the operating room, which is why we have orthopedic surgeon Dr. T. Barrett Sullivan with Bon Secours Orthopedics here with us this midday. Thank you so much for coming in and joining us on this holiday week. So talk to us about what types of neck, spine, and back treatments are offered at Bon Secours.
Of course, yeah, thank you for having me. I tend to talk to my patients about the treatment ladder of spine problems. So surgery is at the top of the ladder. We often don't have to go there because we succeed at the earlier steps. So step one is anti-inflammatory medications and physical therapy. Bon Secours has some great physical therapists that have done a great job helping to get a lot of my patients back to their level of activity. If that's not working, typically we move on to things like targeted injections. So we partner with a number of pain specialists around town who can do targeted injections to try to alleviate pain and help patients have a better response back to physical therapy and, again, avoid surgery. If all those things don't work, then we're in the surgical discussion time zone. And typically we're talking about a number of different things that we offer at Bon Secours. Those include minimally invasive motion-sparing techniques, so decompressions, disc replacements in the neck, disc replacements in the back, minimally and less invasive fusion techniques through tubes or specialized retractors to minimize tissue trauma, and sometimes bigger open surgery like complex revision spinal surgery or adult spinal deformity like scoliosis.
So how do you implement those treatments in a patient-specific fashion at the end of the day?
That's a great question. I think a lot of spine surgeons would agree with me that a majority of our success in surgery is determined before we even enter the operating room. Just like we all have different fingerprints, we all have different spines, and those different spines cause different problems. So I try to take a unique approach to every patient that comes to see me, and that starts with just listening to them, figuring out why they're there, what I can do to help them, and try to figure out what their goals and expectations are. Then obviously I examine them, we go through their imaging, and we try to come up with a treatment plan that meshes their goals and expectations with something that's going to be durable and predictable for them based on the most up-to-date spine surgery literature and data.
AI is changing really everything for everybody. So in the age of AI, are there any new tools that help develop those treatment plans for your patients and what you're doing with them?
Yeah, this is some really exciting stuff that's starting to change our field, just like it's changing a number of other fields, in all of our lives. We have a couple different technologies at Bon Secours that are capable of looking at preoperative imaging for patients, so MRIs and CTs and X-rays. And they can actually look at those images and determine what an ideal spinal alignment should be for that patient. They can also help determine the patient's response to different surgical techniques and try to predict what that patient's postoperative alignment is going to look like. So while they can also help develop a specific treatment plan and alignment, they can actually create patient-specific implants as well. It's pretty amazing stuff. So they can actually print patient-specific rods that are flown in and help us achieve a target alignment, or 3D printed titanium cages that can go in. And these things are accurate down to the level of the millimeter that go into correct alignment in the spine. So I'll give that to you there. That's an example of what you were seeing on the screen there. So down to the 10th of a millimeter to, that is truly one of one. So flown in for that case, for that patient, for that day. So really cool and exciting stuff.
Very, very interesting. You can see how specific it is there. And so then, I guess, once you have the patient-specific plan, what new technologies are helping you execute, these things inside the operating room now?
Sure. Yeah, I mean, like I said, the most important thing is developing the appropriate treatment plan, but you also have to execute that plan. Newer things are coming along, and we have a lot of those at Bon Secours. So we start with enabling technologies like CT navigation. So what that does, it looks at a patient's spine based on a preoperative CT, registers to that to a system in the operating room, and I can look at a screen and see my instruments, my implants, relative to where that patient's spine is in space. So looking up at it as a screen while I'm doing the surgery. That helps to minimize X-rays and maximize accuracy and safety. We also have spinal surgical robotics, which leverages that technology and speaks back to the technologies that helped us to develop the treatment plan. So actually those two things can talk together, and the robot can help you put instrumentation in the appropriate position so that you achieve the ideal alignment that you planned before surgery. And the most recent thing that we have is called augmented reality. And this seems like it's really something out of sci-fi, but these things you can actually put a headset on and look through lenses through the headset. And again, this registers to a patient's preoperative CT or MRI. But the patient will be there in the operating room, headset goes on, and you can look at the patient, and it's like literally having X-ray vision. You can see a 3D reconstruction of the spine where it is in space. So it's pretty amazing. And then you can see where your instruments are, where your hands are, and the implants that you're putting in, where all of those are. All these things are not only fun, but they help us to execute the plan in a safe fashion help us to stay accurate and help us to minimize tissue trauma, which then helps us to ideally optimize recovery and mobility.
I mean, just life-changing work and groundbreaking work all the way around. Doc, thank you so much for coming in. We appreciate it. Thank you also for the demonstration. And we're going to check on the first forecast. Here's Khalil now.